Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast, now part of the Finding Genius Foundation. My guest today is Dr. Christopher Seitz. He's a leading expert in IV therapy. He's a member of the Scientific Advisory Board of the American IV Association, AIVA. So we're going to talk about IV therapy, and I've had it before. I've had someone come to my home and put the needle in and give me vitamins and all kinds of stuff. So that's what we'll be talking about. So welcome, Chris. Thanks for coming.
Yeah, thank you so much for having me. Pleasure to be here.
Yeah, let's start out a little bit with your background and how you got into the science of IV infusions.
Yeah, absolutely. So, I'm a board-certified emergency physician by trade. I'm actually licensed in all 50 states. So I always say I learned how to practice sick medicine really, really well. But then I launched a company, Guardian Medical Direction, where we do medical oversight for nurse-run clinics across the country. We operate in all 50 states, and I've had the privilege of helping over 600 or 700 clinics now start their own clinical practices with nurse-run organizations. We provide the medical oversight compliance resources for them. And as a part of that, started to work with just a bunch of brands and companies in the wellness space, functional medicine space, and then worked on becoming functional medicine certified myself. So I've been able to, again, learn how to practice really good sick medicine, and now I'm learning and continue to enjoy practicing wellness, kind of both ends of the spectrum there.
Right, but how did the IV work come in? When did that start and what's that about?
Yeah, absolutely. So a lot of what we're seeing in the wellness industry, so a lot of the clinics that we support do IV therapy, either brick and mortar or from like a mobile standpoint, like where you kind of described at the beginning here, where they send a nurse to the home to deliver that IV vitamin therapy. So a lot of the companies we work with started doing that. And then along the way, I met some really great people who launched the American IV Association and asked me to sit on their scientific medical advisory board, which has just been an amazing opportunity. So yeah, like probably over 100 and some clinics I've helped, both from a medical oversight standpoint and from a business standpoint, get up and running in the IV therapy space, especially for RNs who are just so well trained to do this and deliver just super high quality care, who can launch their own brands and their own businesses providing, wellness services.
Okay. What are the reasons that people would get IV service? It's like, where is it typically delivered? If you're dehydrated, like how is this move, let's say from just hospital setting, maybe emergency setting out to the public?
Yeah, so it's super interesting. I mean, and it's a good question because we've seen this kind of trend now of, obviously IV therapy was always hospital-based, right? It is an invasive procedure. It's not just like orally hydrating somebody, handing them a bottle of water with some, vitamins in that. It's putting an intravenous catheter in. So, right, so it's a more invasive therapy modality, which traditionally we saw in the hospital space. It's interesting because the transition of seeing IV vitamin therapy specifically go from in-hospital traditional medicine to more outpatient wellness center, patient-specific, health and wellness and preventative medicine, I think really had more to do with this trend post-COVID of healthcare practitioners moving outside of the health. So I don't think it was necessarily the modality itself that moved, but it's clinicians moved. And again, we saw this with COVID. I mean, health system that we have in the traditional is broken. And I think we all knew that, especially as clinicians, but COVID really kind of shined a light on just some of the difficulties the traditional hospital system has. And a lot of clinicians like myself, struggled during that time to continue to do what we were taught to do, which was deliver high quality care. And it was because of resource issues. It was because of funding issues and staffing issues. So there was this trend post-COVID where we saw so many healthcare practitioners starting to move out of the traditional healthcare space. One, to get away from the traditional burnout of, hospital medicine, but also to start this, I think we really saw this push towards wellness and preventative care post-COVID. We realized how much we were missing in that part of our healthcare system. So as the clinicians moved out of that, so did some of the therapies that were traditionally hospital-based, including IV vitamin therapy. So as an emergency physician myself, I was given IV vitamins, and IV fluids to patients, almost every patient I saw in the emergency department for some reason, whether it's dehydration or, new pregnant women who were vomiting.
It's terrible to do it in a hospital setting because it takes like 12 hours for them to even get to you, and it's thousands of dollars. So
and that's
having someone come to your house is a godsend.
Exactly, right. So the cost of it was so high as well, right? So when you're getting in therapy and ER doctors billing and the nurses are billing. So again, as the clinicians moved out, we saw this therapy move out as well because one, it can be so effectively, if done right, can be so effective and very safe to do outside of the hospital setting, but also brings in such tremendous benefits from like a wellness and preventative medicine type of standpoint.
All right. So again, what are the reasons that people would request IV therapy, when they're out and about?
Yeah. So I think the media's got a hold of this a little bit and said, this is for like the bachelor parties and the bachelorette parties. It's actually funny because I see that in the media a lot and I don't see it in the clinics that I work with. So there's kind of three main pillars that I like to talk about where we see, I think, a lot of benefit from the IV vitamin therapies. The first is in general hydration wellness, right? So post-workout recoveries. We work with a lot of athletes who, can hydrate much more quickly and rehydrate much more quickly with IV vitamin therapy. So people who are looking for high performance, high recovery, anti-aging, wellness, preventative medicine. The second biggest pillar that I think is where we should be putting most of our attention is in support of cancer therapy, specifically around high-dose vitamin C. So high-dose vitamin C has been used as a supportive cancer treatment for some time now and has just remarkable effects that we're seeing. The third is in the autoimmune space. So a lot of inflammatory conditions that are like autoimmune, there's a lot of vitamin therapy modalities that can be used to tone down that inflammation and really bring about an alleviation of symptoms for a lot of people suffering from autoimmune diseases. So whereas the media will talk a lot about like, you had a night out and call a nurse to your house, where we really see people and patients having just tremendous outcomes is in those three things. Yes, preventative medicine, rehydration, performance, absolutely. Also in the support of cancer and the autoimmune space as well.
Yeah, I've used it. My family has when we've been sick, and it helps. It gets you through a sickness faster. Most of them, cold, flu, whatever it is. It just makes it, less impactful on you. So yeah, I've never felt worse, and I've always felt a lot better. So does my family. So it's great.
Yeah, and again, you got to think too, like you had mentioned earlier, cost reduction here. How much that would cost to go get the exact same therapy in hospital, in an emergency department is just astronomical compared to what you can do if you're doing it in home. And we're seeing this transition to home care in general and other aspects of medicine too, right? Just general hospital at home programs that even the big payers trying to figure out how to unlock, because I think we've realized as an industry that care at home is just ultimately going to be less expensive if we can figure it out. So
what are some of the things that'll be in the IV drip besides saline, and what will they help for?
Yeah, so there's quite a few. So again, and we're still working, and this is one of the things that the American IV Association is working on, is really putting the research together. The safety of the modality is proven if done the right way. The next thing to really prove is the efficacy. But we do have a lot of data starting to formulate already to say, hey, these different vitamin infusions can really help with different conditions. So typically what you're going to see in traditional, what I'll call IV vitamin therapy services that you see out there in clinics is, one of the big ones is B vitamins, right? So your B6, your B1, all these different B vitamins that really help support the body and support the body's hydration, cellular metabolism, and that type of thing. Other ones like vitamin C. So vitamin C is an antioxidant in lower doses, but can be a pro-oxidant to help fight inflammation. And that's why it can be used so miraculously, I believe, in the supportive cancer space. You'll see vitamin C. Other things you'll see is even like ozone, like O3, as well as nicotinic acid. So like NAD plus is another one that we'll see that can be infused. And again, these have very kind of like pro-oxidant, anti-inflammatory effects that's where we're seeing a lot of benefit in neuroregeneration. We'll see it in supportive cancer treatments. We'll see it in the autoimmune side of things that we can really start to tone down symptoms. So again, B vitamins are the major one. But obviously, like I said, vitamin C, NAD, ozone, these can all be infused through a peripheral IV and have different effects than you would see by trying to orally supplement with vitamins and things.
All right, so let's try to get down. So for just dehydration or supplementation, what will be in there? A suite of B vitamins, vitamin C, like what are the things, what will be in there?
Yeah, general dehydration, fatigue, you say you got viral symptom, virus going on. So we're going to do, again, just the normal saline itself, just the fluids itself can be extremely beneficial and supportive. But a lot of times what you'll see in a typical infusion, you'll see the B vitamins, you'll see vitamin C or ascorbic acid. And usually that's it. It's usually the B vitamins and like vitamin C. And that, along with the fluid hydration itself, can, again, be extremely supportive both with viral symptoms, general dehydration, recovery, and the like. And that would be kind of a typical, we call maybe an infusion cocktail, if you will, for general supportive therapy.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
Okay. And what about for, for people that have cancer, let's say, what would be in there in addition to high-dose vitamin C?
Yeah, so the high-dose vitamin C is really the one. And I'll throw a little thing out here. So for yourself and for your listeners. So one of my colleagues actually in the American IV Association, Dr. Steve Rallis, just wrote a book called When Oranges Become Apples. When Oranges Become Apples. And it's this whole idea that vitamin C at lower doses is an antioxidant. But at higher doses can actually be a pro-oxidant, which means it can damage cells. It's very specific, and in supportive cancer therapy, we found can really help chemotherapy target cancers more effectively and tone down the symptoms of chemotherapy. So it's an amazing read. But yeah, that's typically high-dose vitamin C is one we see in the supportive cancer treatment area. And then with autoimmune conditions and things like that, we'll see other pro-oxidants. So again, like ozone, which is, an oxygen molecule, but 3 of them, so O3, or NAD, which is another, again, pro-oxidant that can help decrease inflammation. So see a lot of patients with autoimmune conditions that can benefit pro-oxidant use as well.
Yeah. So the ozone, is it entrained in the liquid that goes in the IV, or how is it administered?
Yeah. So typically with ozone IV therapy, you pull off a small amount of the patient's blood, you infuse that with O3. So you kind of hyperoxygenate the blood and then reinfuse it back in with other like fluids and vitamins. And that, again, really becomes kind of a pro-oxidant that can help decrease inflammation, increase recovery, and even increase oxygen carrying capacity of the blood, which is, for performance.
All right. Well, what else? I mean, for NAD, I've had that. That makes you feel really weird. It's ache. You just feel like off. It's strange.
Yeah.
It helps me sleep better, like for the 3 nights after. I feel like I have more energy, I wake up easier, I sleep better. But when you're getting it, it's like, kind of like,
yeah. Sometimes
you don't feel good.
Infusion itself can almost kind of give you like kind of a flushed feeling, or almost like kind of like and it makes sense, right? Because it's a pro-oxidant, meaning that it's causing some stress and strain on your body, but it's doing so in a way where, again, our body needs stress too, right? In order to recover, in order to purge out toxins and things like that. So again, you get that kind of initial, a lot of people say with that NAD, they get kind of an initial, general kind of malaise, maybe not feeling great at first, but over time, over a couple of days, they go, wow, man, like I feel tremendously better. Again, like I said, my sleep is better, because it's helping almost clean the body, if you will, of some of these oxidants.
Okay. For the occasional person that is hungover, I guess they have cocktails for them too. Like what would go in there?
That's actually, what's funny is that's going to be the same. So we're typically, especially with people who are like hungover, most of the symptoms of that kind of alcohol, post-alcohol intoxication is just strictly dehydration. So a lot of times we'll do strictly just a liter of fluids, which can help tremendously. But again, throwing in those B vitamins and lower doses of vitamin C helps even more quickly recover and things like that. So you're really going to see almost the same thing from that supportive therapy standpoint with the B vitamins, low dose vitamin C, and just the cells.
Well, what else could be put in? What about glutathione or other substances? Are there new ones that are being added to the list?
I think glutathione is one that we see a lot. People add glutathione. And this is where it becomes interesting. I think this is where the American IV Association and the work that we're doing there help pave a way for. Some of it becomes like, well, wait a second. If I can do B vitamins in the IV, can I do all those other things that go into an IV that are in the hospital, right? And the reason we start now, I think where we're at now with the IV vitamin therapy and strictly looking at safe vitamins like vitamin B, the B vitamins, vitamin C, NAD, glutathione, is that we have to make sure that when we take a modality like this out of the hospital system, we have to realize what the hospital system did provide that maybe we can't control, right? And a lot of that is going to be ongoing monitoring, right? Monitoring the therapies that we're giving. So again, the nurse came to your house, gave you the IV, but she didn't hang out for 5 or 6 or 7 hours and come back the next day. So in some ways, it's kind of, well, hey, the sky's the limit. We can put anything in the IV, once we're all okay doing it. But at the same time, we have to be very careful from a clinical standpoint to say, okay, well, which of these therapies, if done outside of that traditional setting, remain very extremely safe, right? And obviously, like vitamin therapy,
they're probably not going to do morphine anytime soon, but
right, exactly. So things like that. So the question becomes, well, where is that line? And a lot of it has to be with, hey, we need to do the research to really look at what are safe treatments, again, done in the right capacity. And then again, who has the scope of practice to deliver those therapies with the right medical oversight? So yeah, glutathione is another one that we see. There's a lot of buzz right now around CBD infusions. We're seeing people, that's kind of a new thing that we're seeing happen. So again, in some degrees, it says, hey, the way we're administering this medication intravenously is not new. Doing it outside of the traditional hospital system is, and we have to steward that very carefully, very well, to make sure that we're continuing to be able to give benefit and safety without adding risks where there's undue risk.
what do you think is the near future of the IV therapy? What's right around the corner that's being evaluated right now, and you think soon may be in common use?
Yeah, I think one of the first things we have to do, and this is one of the big missions of the American IV Association, is we really have to create a standard of care in the industry. And that's one thing that I think has been missing, is that there was this outflux of clinicians and these therapies that started, but there really no standard was built. So one of the things that we're working on with the scientific committee with the American IV Association is putting together guidelines around what is a safety and efficacy standard of care that any clinician who's using these types of therapies in their practice outside of the hospital setting should follow, that we can then gather data around to show the safety and efficacy of these treatments. It's actually interesting. I've seen this trend where I'll use IV vitamin therapy as the example. We took IV vitamin therapy out of the traditional hospital setting, started to, kind of use it. We're seeing a lot of good outcomes. We need to gather more data and research to really show that. But already we're moving on to this idea of precision medicine. And you hear people talk about it a lot. Well, hey, precision medicine is me figuring out exactly who you are and exactly what you need and all of your labs and all of your genetic makeup and tailoring my therapies to you, which I would argue is medicine, right? I mean, every medicine really should have always been that way. But at some point, as we learn more, we have to build standards of care. I used to teach advanced cardiac life support, and we follow the AHA guidelines. And I used to tell my residents, hey, you have to know these guidelines inside and out, so that when you deviate, when you have to deviate from them, you know why, right? But if you're never going to even follow the guidelines, how do you know what you're doing is actually of any benefit at all? And that's where we really, I think we're at in the IV vitamin therapy industry right now, is that we have to set a standard of care first and really build that data before we can just keep jumping to the next thing. Because I truly believe, and this is as a physician myself, if you look at where healthcare is going, healthcare is entering into the home. You look at the value-based contracts that, the big payers are doing. You look at a lot of the digital health companies that are being launched. Everyone's trying to figure out, how do we bring down costs of healthcare? In order to do so, bring it into the home. But we really can't do that until we know what therapies are safe and effective and how we should be put into the home. And that comes with, again, building out these standards of care and stuff like that. So it is interesting because it really opens up a whole world of possibilities to us. Again, I'll go back to what I said before. We have to steward that so well as clinicians because we have to be very careful. And again, that's where the American IV Association is really trying to partner with the regulators, partner with clinicians, partner with the patients even to say, hey, listen, like there's a lot of benefit to be had here, but how do we come together to really build out guidelines, standards of care, and choose to drive the industry forward, not react to how it's being driven?
Well, again, where is it headed that you see? What substances are coming that are, actively being evaluated? What's coming really soon?
It's a good question. I think that one of the things that we're seeing, the big trend right now is, again, more towards that pro-oxidant, anti-inflammatory types of treatments. So there are other ones. So the other thing, though, is that shortly on the heels of that comes all of your functional medicine. So your hormone replacement, your peptides like GLP-1s. If we can do IVs in the home, why can't we do these even patient-administered self-injections of peptides and hormones and things like that? So I think that's where we're seeing, that's kind of the natural progression next in the wellness space, especially where we're seeing IV vitamin therapy used quite often, is then getting to, well, hang on, can we also do, again, hormone replacement therapy? Can we do peptides? And not just even the FDA-approved peptides. There's a big push towards like, well, hey, a lot of these experimental peptides that seem very safe are not FDA-approved yet. Can we start to utilize these? And this is, again, where we just have to be very careful. I think there is room for all of that, but there needs to be standards of care built.
All right. What states is this available in? Which ones is it not? Or is it available everywhere?
Right now, it's available everywhere. Yeah. I mean, so like I said, our company, Guardian Medical Direction, we oversee clinics in all 50 states. Again, the American IV Association obviously is operating as an advocacy group in all 50 states. So yeah, I mean, the only limitations that we run into now become really pharmacy. So again, how do we appropriately and safely ship and sell and distribute pharmaceuticals? But again, the most difficult state right now would be California, mainly because there's only one compounding pharmacy that can operate there, but it is accessible and available in all states.
Did you say there's one compounding pharmacy for all of California?
There's one 503B compounding pharmacy for California. So there's also that can ship. So it's like a company that can actually ship to California from outside of California. Otherwise, you have to use a pharmacy that is located in California and can ship to you in California.
For certain protocols, I could see you guys being an extension of a local pharmacy. Like if you have elderly people or disabled ones or ones that need certain protocols that, come once a week, why not make it an extension of pharmacy where you guys go out and provide that care in the home, either bringing pills, bringing IVs, etc. And it's all kind of in one,
Absolutely. I mean, and this is one of the things, it's one of the biggest opportunities to really partner with pharmacies. Hey, I mean, like pharmacies themselves have obviously like a patient list. Like they care for patients through the pharmaceuticals that so finding those partnerships to say, hey, how can we utilize your formulations and your dosages and how you distribute the medications to connect that with clinicians providing these services in the home? Yeah, I mean, it's a huge opportunity. I mean, if you look at what, Amazon and One Medical are trying to do, it's somewhat similar, right? Can we bring the pharmacies and the clinicians and the accessibility, of delivery to patient home all into one thing so that we can, again, really reduce the costs of healthcare in general and bring medicine really to your door.
What about wound care, wound dressing, stitches? Like how much of this do you think will be outsourced to these local providers?
So that's already happening too. So, I mean, there's actually, you look at MD Ally, for example. So they are really like a home response. So, wound care, they'll do patient assessments. There's even pilot programs looking at ER at home, meaning, hey, maybe you call your local doctor and you say, hey, I'm not feeling well. I'm not sure what I need to do. Oh, but it's after hours, right? Or, you know what, we're booked up today. So if you think it's an emergency, you should probably go to the emergency department. Well, what if there was another option? What if it was, hey, why don't we send a nurse to the home and we'll do an evaluation and really decide if you need to be seen in the hospital or not? And that's what we're seeing, again, like companies like MD Ally. There's already companies doing that and piloting that. And again, seeing a lot of results. What it always comes down to, though, is cost, right? Can we afford to staff these companies with enough clinicians to be able to respond in a timely fashion before utilization is high enough to cover those costs? That's where a lot of these companies get challenged.
Well, it'd be interesting if you had insurance and you have a copay, but if someone comes to your house, maybe the copay is higher, but some people may be willing to pay it, and therefore they won't have to take a trip to the hospital, the ER, waste hours, or urgent care. They could just get it done at home, It seems like it would be a big benefit.
Well, and that's the thing. That's where I see the industry going, because we'll have to. The cost of healthcare is high. We have to be able to reduce costs. The biggest play right now is who can unlock, through, again, value-based contracts with payers, some type of at-home care system. And the technology has advanced advanced in a way where this is more doable than it's ever been, right? I mean, telemedicine technology has advanced so much, during and through and after COVID, that you can do real-time assessments of patients very effective. There's even research to say that, hey, maybe even more effective. But on top of that, remote patient monitoring, right? If I have a connection to your Apple Watch in my electronic medical record, and I can see you, and I've got a nurse on scene who can get your vitals and do an assessment, I'll be honest with you, I probably have more data than some ERs do in this country. You know what I mean? So it's definitely the next thing. It's definitely what we're going to see happen. The question is, again, the challenge, I won't see the question. The challenges are going to be, one, patients' acceptance, right? Do patients accept that kind of care? Are they comfortable with that kind of care? Which I think we're seeing the patient population saying yes to that. The other challenge is going to be, again, reimbursement. And the payers figure out how to reimburse around this in an effective enough way that we can keep these programs running, but also still reduce costs without just all of a sudden these programs are just expensive as when you were in the hospital.
Yeah. No brain surgery and homecoming though, right?
Yeah, I don't think anytime soon. I guess someday, someday with AI, who knows?
Okay. Interesting. So which states seem to be pushing this forward the most, and which ones are kind of still behind the game?
Yeah, I mean, I think from a clinical standpoint, we see really all clinicians in all states really accepting this as an appropriate and probably needed way of delivering care. I think where we have challenges to overcome are with more the regular, right? So the medical boards and the nursing boards, who their whole job is to make sure that patients are safe. And again, going back to my comment earlier, we have maybe not necessarily built standards of care yet to convince these boards that this can be safe if done the right way. You hear about this being done inappropriately by unlicensed people. And of course, that takes the media and that, then the board has to step in and say, hey, we need to protect people. And a lot of times, in order to do so, they have to restrict things. And again, the American AIVA Association, we're really trying to partner with the regulatory bodies to say, hey, we think that we can show you from a clinical standpoint how this can be done very safe and effectively so that we don't end up over-regulating and preventing this type of care to be, but it does have to be delivered in the right way. Some of the states where we see it advancing quickly are the same states where the boards are starting to take an interest, right? So states like Texas, California, Florida, for sure. Tennessee, Georgia, New York, we see a lot of these things being pushed for, really in all states, but those are the big ones that come to mind for me. And that's where we see the medical boards really taking an interest, rightfully so, to say, hey, guys, let's make sure we're doing this safe. So the hope is that we can partner with them to do that. We can really advance this forward. And they have the same job we do as clinicians, right? The job of the medical board, the nursing board, is to protect people and to oversee the clinicians. And we as clinicians, that was the first thing that we promised, right? Was we would first do no harm. So again, that's where we really could find these partnerships, I think, and push it forward together have the most sounding impact.
You said you worked in an ER for a while, right?
Oh, yeah. I did travel medicine for 4 years. I did my residency training at Beaumont Hospital in the Detroit area. I worked in the Detroit area for a couple years, and then I did travel medicine for about 5 years.
My question is, what percentage of people that go to the ER don't really need to go there? What percentage could be addressed by in-home therapies like this?
I would say 90%.
Wow.
Yeah. The reason is it's because of the shortage of physicians we have as a whole. So again, as an American, your access point to healthcare was always supposed to be your primary care physician. And maybe for a time it was, but that quickly changed. Right? There's not enough primary care physicians. We're really not adding many every year. If we're being honest, you look at the data, we're going to have even worsening shortage by 2030. You can't get into a primary. Everybody knows this, right? I can't even get into my primary care office. So what happened is that the emergency department became everyone's first point of contact and access point to health. Because in some states, there are some cases I can't get to my primary care physician, but if I go to the ER, then I can get a follow-up visit the next day, whereas I couldn't otherwise. So the ER has become our primary access. And the ER can't turn you away if you don't have insurance, if you don't have money to pay, right? So you have to see you. So I think most of my emergency physician colleagues would agree. I think 90% of what I would see during a shift could have been cared for outside of.
What does this look like in the future? Someone goes to an ER, they have a triage person that says, you know what, this can be done through home therapy. We can make a call for you and schedule you tonight. All right, we got it, go home, and so come to your house and do the same thing for you.
Yeah, and I think you can even be a step before that. I think we're seeing programs that are piloting, hey, before you even show up and you call in or you check in. I used to work in emergency departments where we would get phone calls. We would get phone calls of patients calling in saying, hey, how long's the wait? And if it was less than an hour, they'd come in. If it was more than an hour, they were okay till tomorrow. So it's just kind of like, but yeah, I think there's a point where you even before that, where the patient calls into their primary physician's office or even calls into 911 or a triage type of thing and says, hey, here's what's going on. And a general assessment is done. A nurse or paramedic, if somebody sent to the home, does the evaluation. Physician is telemedicine in just to make sure that everything was okay. They're either then sent to the emergency department if it's true emergency or home care, and different things are set up. Absolutely. I think it's definitely where we're headed. And I think I see a lot of companies and programs and, trying to pilot it out to make sense of it. We've made some good headway, but I think, again, this is where, Guardian Medical Direction, like our mission has always been to really empower clinicians to deliver high quality care. But like our job is to create a gold standard in medical oversight and compliance. So with the right oversight structure in place, I mean, there are 5 million nurses across. Why can we not tap into to this other provider pool that has solid training and, great licensure and a scope of practice, and start to actually use the people we have? And we kind of have this old school mentality of like, well, if it's not the doctor saying it, then we have to wait till they do it. That has to change. We don't have enough physicians to even do that.
Well, not only that, I mean, I've seen scenarios where you're waiting on the insurance. I've seen people open on the operating table and they're calling the insurance to see if they can proceed. Insane.
Yeah. And I think the payers are starting to get wise to that a little bit too. I mean, to some degree. I think, again, like I've even had conversations, with some of the major national payers who are looking at how do we do this and do it well? Because we're going to have to figure it out. You know what I mean? And I think the technology is there. I really do think that the technology advances we have today, I think will allow us to do this in a very safe and effective fashion. And it's kind of going full circle, right? Like if your doctor used to come see you at the house, there wasn't a hospital to go. You always have to get back to that somehow. So.
Interesting. Okay. Well, what should people search for if they feel like they're in need of this? Is it just IV therapy near me, or what's the best way they can find out more?
Yeah, absolutely. I mean, I think, one of the things that I'll encourage, because again, as the American IV Association, as we try to drive a standard of care to the industry and be the voice of the industry, while we're working on doing that, I'll encourage patients, again, be the CEO of your own health. Right. So if you Google, IV therapy near me or IV vitamin therapy, you could find something, but do your due diligence as well. Right. I mean, that's why I would encourage you. The American IV Association has partnered with a lot of great clinics and that are doing this the right way. So just doing a little bit of due diligence to make sure that the providers you're going to see or the businesses you're going to visit have the right medical oversight and medical directors in place, have the right protocols, standards of care in place. Yeah, that's not the patient's responsibility, but again, we do need to make sure that we're paying attention to that. So yeah, I mean, like I said, you can Google this anywhere, but yeah, I would encourage people to also check out the American IV Association itself to see what their partnered clinics and things are doing, because that organization, we actually have like a certification process that clinics can go through. Again, our scientific committee, we recently put out guidelines around how this should be delivered. So, those people are doing it right.
All right. Excellent. Well, very good. Very good, Chris. Thank you so much for coming on the podcast. I appreciate it very much.
Thank you so much. It was a pleasure.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.